20 years old, want lower bleph for hereditary eye bags. What are the best options? Are risk the same at any age? I have had these bags since I was 12. I do not have any allergies, and my thyroid is in excellent condition according to tests my doctor has done. Is 20 too young for lower bleph in my case? Since I am young, am I still at risk for crepey, wrinkly skin in the eye area after surgery? How worried should I be about sagging lower lid, scleral show, or other complications? What would be the best way to remove these?
Thank you for your question. At the age of 20, you made a very nice observation that you've had bags under your eyes since the age of 12. And the question you're asking about is whether or not you should consider having a procedure done, and are you at risk for the crepey quality of skin or wrinkles after the surgery? Well, many of my patients who come to me in their 30s or older will often mention that they've had bags under their eyes since they were teenagers, which basically essentially enforces the concept that very often this is a hereditary problem and that people have a genetic tendency to have these fat pockets from under their eyes. So to answer your first question about whether or not you're a candidate at the age of 20, I can share with you that one of my patients, who was the youngest patient we've ever done for bags under the eyes, was actually 14 years old. So for him, the bags under the eyes were so significant that he was being teased at school for being on potentially on drugs, and he became very withdrawn about this particular aspect of his appearance. So we have done this kind of surgery for people who are young, like yourself, in their 20s, and in that 20s to 30s is typical of the younger group that does this procedure. So most likely the approach that I would do for you would be a transconjunctival blepharoplasty. That means that we're able to get to the fat pockets and reduce them from the inside of the eyelids. Now, what we're doing essentially is dealing with the herniated fat, the fat that's pushed forward and is causing those bulges to appear. When we do this reduction from the inside of the eyelid, essentially no one can ever tell that you had surgery. So that would be typical in my practice for someone who's young. Also, when you are young, you have many good things going for you, one of which is good quality, thick skin. And so you're really not at risk of having any significant crepiness or wrinkling to your skin. So unlike somebody who is older or has had a lot of sun exposure, let's say someone in their 40s or 50s, where I would routinely employ lasers and other things to improve skin quality, in your situation at the age of 20 with your skin type, I would probably do nothing. I would just take out the fat pockets in the way that is most appropriate for you, and after that's resolved, you would basically be able to continue your life without really paying that much attention to this area. It doesn't stop the aging process, but as far as that herniated fat, a transconjunctival blepharoplasty is pretty clear, much clearly what would be right for you. You may certainly wait until any other threshold in terms of your readiness is reached, but certainly it's fine to do it at this age. And as far as skin quality is concerned, I would not be concerned about the skin being crepey afterwards. You might see a few lines you never noticed before, but one of the golden rules of cosmetic surgery is people notice a lot of things after surgery that they didn't notice before because they're paying particular attention. So that's where having good photos before and after is helpful. So I thank you for your question. I hope that was helpful. Take care and good luck.